here when I need some relax and calm in my life. So I think this is the perfect scenario to talk about mental health, to talk about an essential issue for our societies we have forgotten maybe for so long. For me, staying here this morning is a huge pleasure, and I'm going to try to make it for you as well. Si me lo permiten, voy a empezar con una anécdota.
If you'll allow me, I'm going to start with a small personal and professional anecdote that has a lot to do with why we're here today. I'm going to tell you some over today. I hope you're not getting bored. And if you do, please just raise your hand. I'll shut up. I've been going around the country for about 9 months, doing a documentary on suicide in Spain, listening to terrible stories. Over that time, there are certain names that I think I will never forget. It's names that they're just stuck in your memory. I'm going to start with one of them. It's Patricia. It's the name of a woman whose actual name is not Patricia. And it's the name of someone, it's a woman who did not want us to record her face because she told us a terrible story. Her grandmother had committed suicide, her daughter tried, and she had tried as well. And for the first time, she was taking that step of actually talking about it. So she asked us to have this anonymous option. So we did the interview that was about 3 hours long in recording. It was a hard interview in which we talked about guilt, about stigma, about taboos, about solitude and prejudices and feeling judged. It's an interview in which the team cried a lot, honestly. It was one of the things that we had to fight against, try to make the pain not to be too far away from us, not to be too foreign to us, but also not letting it be our own pain so that we could not continue the interview. When we finished the interview, she looked at her husband, who was behind all the cameras. He was completely in shock, and she looked at him and she said, "Do you understand now what it has been like for me over these years?" We were in shock, we were petrified, and the woman called me and she said, "Thank you very much, because I was able to tell to the camera something that someone has asked me about before, and I was not able to tell my family for 14 years. A month and a half later, we had the premiere in a huge cinema in Madrid with 600 people, and the woman in the Q&A, she raised her hand, she said, "The one that appears with a covered face in the screen, that's me, in front of everyone." So for me, that was a step forward. It was a huge step, and I believe she overcame many emotional barriers at that time. And I believe talking about her story, about Patricia, is talking about mental health. And that's what we're going to do over the whole day today. So let's start. We're going to open this high-level meeting that is organized by the Health Ministry in Spain in the framework of the Spanish Presidency of the European Union, Secretary of State, Mayoress, C Unit. Be very welcome and good morning. I'm going to ask for the authorities to come up to stage, the Mayoress of Avilés, the General Director of Public Health in Avilés, and the Secretary of State for Health.
El camino, verán que es largo.
You'll see there's a long way to come here, so we'll have some silence moments over here, but I'll try to make them a bit less boring over the day today. Please don't ask me to make jokes because I'm not very good at it. Mayoress Mariví Montesering. It was hard for me to learn that name, but I could make it in the end. Good morning. If you want, you can just speak from your chair, or you can also speak however you want. It will be your turn. You'll have the floor. Good morning, Mayoress. Thank you for this warm welcome in Avilés. You have the floor. Thank you very much. Good morning to everyone. Welcome to Avilés. It is an honor for our city to be able to host this high-level meeting, this conference on mental health, who is established in the framework of the Spanish Presidency of the Council of the European Union. There has been some days already since we started all this, and on the 13th of September was the technical headquarters for the European platform to to fight synergism in the same space. So I have double reasons to share as the mayoress of Avilés to the government of Spain and the European Union for turning this international center as one of the important key points for the Spanish presidency of the of Spain in the European Union. I'd like to start by welcoming the Secretary of State of Public Health, Silvia Calzó, who knows us. She knows the city, she knows this international center, and most importantly, and she knows what we have been doing here. Also, Ángel José López, the General Director on Public Health from our government of Asturias. I also want to thank the previous team of the Health Regional Directorate for Health, because Pablo Castel, because he had quite the intention of bringing this topic of mental health to our city. And being really humble, I really believe it is a good place to host this high-level meeting, because this city, we have placed the attention and the focus on mental health on a strategic axis of the city. Avilés has been international reference for many years in the assertive treatment for the community. We have here the director of the symposium, Héctor Tambrina, and as you all know, it is an approach on the system of attention to people with serious mental disorders that substitutes the compulsory medical intern by taking care of the people in the community, in the city, in their own social environment, in a way that we can guarantee the normalization of the life of those patients. It is true that we are living very complex times in the matter of mental health. The pandemic, without a doubt, made it worse for the mental health problems and for emotional problems, with special incidents as since we have detected it in young people and in the elderly. That is why from the local council of Avilés, we encouraged a pioneer program that was created by our Council of Children and Adolescents that is preventive, and it's aimed for people who have sentimental or psychological problems that has a lot of professionals working in it, and they are going to counsel them with their doubts and conflicts for those situations that require some kind of healthcare treatment. We also work with a strategy against unwanted solitude that is targeted towards the elderly to try to encourage this coexistence in social relationships in order to try to fight solitude and loneliness, so that we can fight these problems regarding mental health. Our priority is mental health as administrators of the public well-being, and it's a preventive task that, without a doubt, is essential so that the social healthcare services can actually work in what they're specialized and what their mission is. Therefore, we work together so that those public services for mental health in the healthcare system can actually do their job better, so that we do not make them do some other jobs that we can do from our community, from our regional government, so that each one of us can solve in the best possible way the difficulties that we may have in life. That is why I believe Avilés is a very appropriate city to host this meeting, and for us, this meeting is support in this challenge that Avilés has to try to build a city that is emotionally healthy and happy. That's why I believe this is the great challenge that politics has to deal with and the administration has to deal with. So my most honest words of thank you. I do not want to extend any further. I want to thank the government of Spain and the European Union for having chosen Avilés as the city to hold this meeting, so that it will allow us to reflect over the day on the new challenges in the new strategy for mental health in Europe. Thank you very much for your attention. I hope you have a happy and fruitful day, and I hope it is very useful for you in all senses. And I hope you can enjoy a little bit from this city, which is small, but it's very warm and welcoming. Thank you very much.
Muchas gracias, Alcaldesa Maribel Monteserín.
Thank you very much, Mayoress. Now the General Director of Public Health from the region of Asturias, José López.
Buenos días.
Good morning. This region is small, and its administration is also small, so some of us have to work double. That's why I'm in this meeting, this presentation, and a little bit later I will have an intervention in one of the round tables, so I will not extend too much in this moment. I will not dwell too much because I will have the opportunity a bit later on to share with you, well, the work that we've been doing. I just wanted to give a couple notes. First of all, for us, for Asturias, the fact that this event is being held here in our region is a reason to be proud, because it basically means the acknowledgement of a path that started this year 40 years ago with the start of the psychiatric reform in the Hospital of Quality in Oviedo. It has been a hospital that I was there 20 years ago. I studied my 4th year of university there. I had a rotation there, and it had 200 people hospitalized there. That reform changed the situation to our reality, in which we have 16 healthcare centers, 7 hospitalization units, hundreds of professionals, and in which the communitary model is the flagship of our network. That itinerary, which did not lack problems and tensions and difficult situations, is what we understand that this event is acknowledging, and they do that in the figure of some professionals that I would like to mention. We have Victor Aparicio over here, is one of the fundamental psychiatrists in this process. We also have the Counselor of Social Services and Healthcare, or Javier Montel. In this sense is why we are especially thankful for the European Union and for the government of Spain for having brought this event here. After that, well, every country and region have their own reality and their specific problems, and we will talk about all of them all around the day. I could also, within the protocol, sell you the idea of Asturias, but with the current climatic situation, Asturias can sell itself. And that's all from my side. Thank you very much.
Muchísimas gracias.
Thank you very much. Of course, Asturias can sell itself on our own. It is a paradise, and if you'll stay here for some days, I highly recommend you to visit it. Now we have the European Commissioner for Healthcare. It's Estela Kierikides, who has left us a message.
Friends,
Compañeros,
another pillar of our European Health Union, Europe's comprehensive approach to mental health. 1 month ago, to mark World Mental Health Day, I hosted a high-level conference on mental health in Brussels, to which Spain's Health Minister, José Miñones, sent a warm and encouraging video message. During this conference, I spoke about the immense importance for us to shine a light on mental health like never before. Today's high-level meeting is shining this light. Mental health is very high on the agenda of the current Council Presidency trio of Spain, Belgium, and Hungary. And thanks to Spain's strong commitment, Council conclusions on mental health are currently under discussion. Our comprehensive approach to mental health has received solid support from the European Parliament, from stakeholders, and from our citizens. This overwhelming support clearly highlights a shared commitment to improve mental health outcomes in the EU. The comprehensive approach will undoubtedly help member states meet the UN Sustainable Development Goals and WHO targets on non-communicable diseases. It will also reduce the burden on national healthcare and welfare systems, It will relieve the pressure on limited budgets, and it will promote economic productivity and growth. All these thanks to a healthy workforce. With 1.23 billion euros in funding opportunities and 20 flagship initiatives, we will be able to make a difference to the lives of our citizens, focusing on socioeconomically disadvantaged and vulnerable people. Dear friends, together, we have laid firm foundations on which to build. Now we can focus on implementing the flagship actions in close cooperation with member states, with stakeholders and our international partners. There is no time to lose. According to a recent Eurobarometer survey of EU citizens, almost half of the people surveyed had experienced an emotional or psychosocial problem, such as feeling depressed or anxious, in the previous 12 months. It's therefore high time to come together to bring about change for the better. And your conference is a welcome contribution to that effort. And I look forward to hearing its outcomes. Thank you.
Thank you so much, Commissioner. La comisaria, que estoy seguro, no me cabe ninguna duda.
I am sure she's watching us throughout the streaming services so that this event is being streamlined. You can watch this in your house. So I would like to thank the technical workers here in the room, to all the sound technicians and everyone working here today. I'd like to call now the Secretary of State for Healthcare, Silvia Calzón. Secretary, good morning. Welcome. Thank you. Good morning. Thank you for giving me the floor. Mayoress of Avilés, dear Mariví, General Director of Public Health and Attention towards Mental Health, General Director for Public Health from the Ministry of Healthcare, authorities, experts, panelists, friends. Good morning, everyone. It is an honor for me and a pleasure on behalf of the Ministry of Healthcare, who will be here with us in the closing event. I'd like to welcome you all to this high-level meeting on mental health. We are hosting it, as you all know, in the framework of the Spanish Presidency of the Council of the European Union. For us, this presidency has meant an intense work. We have been working for 5 intense months. This is the 12th meeting of this kind that we have organized. We have talked about such important matters, and some of them in the field of healthcare, such as digital healthcare, child obesity, cancer, or complex diseases. But this meeting is very important because it is the last high-level meeting that we will host before the EBSCO, the Ministers' Council, that will be happening on the 30th of this month. And it's not out of coincidence that this meeting is being held here. The choice of the place is not random, and the topic of this meeting, this high-level meeting, is not random. It had to be in Avilés because it is a benchmark nationally in the work tackling mental health. That's why in the Ministry of Health, we want to thank especially the Mayoress because of the warm welcome we've received, but also, and this is even more important, for their continuous intention of renovating the situation for this different treatment towards mental health, not only for treatment, for prevention, but also, as she herself was saying before, for the promotion of health. Thank you for building that model of a healthy city, also in everything that has to do with mental health. Also, thank you to the regional government for health in the region of Asturias, to the current councillor, Conchita, and the previous councillor, Pablo. Pablo, thanks to your generosity in the ministry, we continue with special interest everything that was being done in Asturias, and most especially in Avilés. It's a series of good practices And all in all, Pablo, we have to be generous. You had to be generous not only to invite us here, but also in a continuous way to invite the whole ensemble of the whole system of health to learn from these practices. I said it's not the choice of a place is not out of coincidence, and the topic has the same situation from the government of Spain and the Ministry of Healthcare. We knew and we were clear that from the presidency of the the Council of Europe, mental health would be a priority that we wanted to discuss, and we wanted to set it on the table. We wanted to talk about this, knowing what's happening in all the countries around us. The European Commission has adopted in the month of June the communication on the need of a global approach on tackling mental health. And from the Spanish Presidency, we wanted that in the informal meeting of the ministries of healthcare from all the European countries that happened in Las Palmas in July, we wanted mental health to be one of the topics for debate. We also wanted to have a decision for the European Economic and Social Committee on mental health, and we will share their recommendations with you today. But we wanted to finish this stage of the Ministry of Healthcare in the European presidency by presenting in the last meeting of health ministers, which will happen on the 30th of this month, as I said before, the conclusions of the Council in the matter of mental health. That is why today's high-level meeting, will work as the perfect introduction for the debate in order to give more visibility to it. We also want to share with all of you our experience from the Ministry of Healthcare. Many of the representatives will be talking about this today, because in Spain, such as it happened in other countries in our surroundings, COVID-19 meant widening of some problems that were pre-existing regarding mental health, also the apparition of new mental health problems, and also COVID-19 also gave us an opportunity, because facing that health crisis that had no precedents meant, at least to which regards mental health, a turning point with regards to visibility and to the capacity of talking about it, not only in the political debate, but also for the media. Also, for our young people to be talking without any taboos about mental health. That's why mental health, over these last 3 years, has been a priority for the government of Spain. And we have tried to show this in 3 main pillars. The first is the renovation of the mental health strategy from the national healthcare system for the period 2022-2026. It has been an effort that we have done together in the system, both from the ministry and also from the regional governments. And also I'd like to highlight it here, Celso. It has been an effort from the scientific societies, from the experts, and from the patients themselves, for trying to look for consensus and using this new strategy. Secondly, through the creation and later implementation of an action plan towards mental health for the period 2022-2024. It is an action plan that has received from the Ministry of Healthcare 100 million euros, most of which has been transferred to regional governments, so that it's an encouragement for the implementation of the 6 strategic lines and 44 measures that the plan has. But it is a plan that also has measures that are as important as for example, one of them is so important that we'll have its own round table over the day today, and the start for the first time in Spain for a telephone line for suicide prevention, which is 024 here in Spain. It is a free service that is available from all parts of Spain, and it's a line that we know has been completely necessary. It started on on May 10th, 2022, and it has answered almost 180,000 phone calls. Um, Almost 750 had showed the need to activate suicide prevention action. And the third pillar is actually betting for human resources. We can't be working in in mental health if we are not aware that we have wide room for improvement in the matter of human resources. Over these 3 years, we've achieved great milestones, and in August 2021, we passed the royal decree that created the specialty of child psychiatrist option, and it was a specialization of the national exam that doctors have to take in Spain in order to become doctors with their own specialty. And the new residents in May this year, and the current exams, there have been 30 openings, and there are 878 professionals in this country that have received the certification. They were professionals that already worked in the psychiatry field with children and teenagers, and they have acquired by the extraordinary way that was set on this decree. And it's not only about improving the resources and creating them for child psychiatry and teenager psychiatry, but also it's about improving resources in the whole healthcare training that is specialized in the field of mental health. When I talk about this, I also talk about adult psychiatry, I talk about clinical psychology, and also want to talk about mental health nursing, because from 2018, both the ministry and the regional governments together, we have done an effort in order to increase in more than 56% the offer of these positions for the specialized training spots. As I said, we have worked a lot, very, very hard over the last months, and we are really aware that we still have a long way to go. And that is why we're holding this meeting. We want to share experiences, we want to see where we're going, and we want to keep on creating a future together. We always say that we're all subject to have, along our life, some kind of mental health problem. And indeed, we all could suffer from it, but we can't forget that we are not all as vulnerable. And mental health is clearly linked with social factors such as gender, educational level, socioeconomic level, or unemployment situations. And when we have so many factors that are actually having an impact on the same problem, the sole solution can come from a comprehensive approach in which we are working from many different sectors. The complexity of this problem makes it necessary to create alliances and partnerships. It's not enough to be working only from the healthcare sector. We also need to be working from the regional government, the local governments, and we also need work from other sectors. That's why I want to end up by saying thank you, most especially to those people who are here today for this high-level meeting on mental health from the Ministry of Education. Dear Monica, thank you very much from the Ministry of Universities, from the UNICEF, from the foundation that's called Siloe, and also from the representatives of patients through the Confederation of Mental Health. I was saying that we still have a long way to go, but without a doubt, that way will be easier and it will be more fruitful if we do it together. Thank you very much.
Muchísimas gracias, secretaria de Estado.
Thank you very much, Secretary of State Silvia Calzón. I want to thank the three of you for being in this opening event. She has given it an intense number from the number of calls that we received in 024. I was talking last night with two of the people who work in this phone attention service for suicidal behavior. And it's a lot of calls. It's a really dramatic number, and it also reflects some other topics that could represent structural failures. So we have to tackle this problem from very different perspectives, and it's very hard to do so. But that's the goal of this event. It's an event that will be structured around 3 roundtables that we'll show now. Also, we're going to be tackling some specific circumstances and situations in which we have to pay special attention to when talking about mental health. But before we finish closing this starting point, we'll talk about in the European field, because since this is a meeting in the European framework, of course, I'd like to talk to Stefan Schreck, because he's the counselor of the General Directorate for Healthcare from the European Union. Good morning.
Are you there?
Thanks to the work of the technicians. Yes, it is of course a pleasure for me to be here today at this important presidency conference. I am pleased to see today's participation and commitment from everyone to address mental health issues. This gives me hope that we are on the right track, as we need the commitment and cooperation from everyone to reduce the burden of mental health issues on our society. Data from before the COVID-19 pandemic show that mental health problems were known to affect about 84 million people in the European Union. And that is something like 1 in every 6 citizens. The estimated cost of mental health issues cost the economy annually over 600 billion euros. That's more than 4% of GDP. A Eurobarometer study published ahead of this year's World Mental Health Day reveals the following. 46% of Europeans experienced an emotional or psychosocial problem, such as feeling depressed or anxious in the past 12 months. And 54% of persons with a mental health issue have not received help from a professional, according to the survey.
So, Mr.
Luckily, 89% of people interviewed consider that mental health promotion is as important as physical health promotion. This is also one of the main aims of the new Commission communication on mental health. As you all know, this summer we launched Europe's first comprehensive approach to mental health with an overwhelming support. We did this with an impressive speed. Only 9 months after President von der Leyen announced a new initiative on mental health, the new communication was adopted. This is the beginning of a new way of working on mental health that goes beyond public health policy and strongly includes other key areas such as education, employment, digitalization, research, culture, urban planning, environment, and climate. As said earlier, this will help to make mental health a priority equal to physical health. We have 3 principles that are the basis to guide us achieving our objectives: adequate and effective prevention, access to high-quality, affordable mental health care and treatment, and reintegration into society after recovery. The communication is the final pillar of the European Health Union. The communication has 20 flagship initiatives and identified 1.23 billion in funding opportunities, which will allow us to put our promises into action. The 20 flagships have been developed in close cooperation with all relevant Commission services. Let me give you some examples. This year, the Commission will allocate 11 million euros to support member states in building capacity for an approach that promotes mental health across policies. Promoting good mental health, prevention and early intervention is done via flagships such as the European Depression and Suicide Prevention Initiative and a European Code for Mental Health. Actions to boost the mental health of children and young people will include a prevention toolkit, guidance on protecting minors in the digital world, and a child and youth mental health network. As with all EU health policy making, the focus is on helping the most vulnerable. We have specific flagships for groups such as victims of crime and young cancer survivors. An EU-level initiative on psychosocial risks of work and 2 EU-wide workplace campaigns will help to tackle work-related issues. Reinforcing mental health systems and integrating a comprehensive approach to mental health is ensured via an initiative to train healthcare and other professionals, technical support across sectors, and through additional data gathering. Breaking through stigma and addressing discrimination is done via transfer of best practices, awareness raising and communication activities, and the development of EU guidance on stigma and discrimination. We will address international aspects of mental health with 30 million euro support for Ukrainian displaced and affected people, and through a minimum service package for psychosocial support. So now we are in the implementation phase and many activities are ongoing. We will continue to work closely with member states through the subgroup on mental health of the Public Health Expert Group and with stakeholders through the new network on the EU Health Policy Platform to implement the flagships and other actions of the communication on mental health. It is clear that this has to be a joint effort, as governments and public authorities alone cannot effectively address mental health issues. We have EU funding instruments available for member states and stakeholders to implement projects that support the communication on mental health. This year, there is over 18 million euros available under the EU for Health programme. Member states are supported via a new joint action on mental health. Projects by stakeholders on mental health and cancer and on addressing vulnerable groups are also supported. Following the adoption of the new communication on mental health, we launched a call for best and promising practices on mental health. The proposals received are currently being analyzed. We will then support member states that wish to transfer a best or promising practice into their country. We are also advancing on the implementation of flagships. A call for tender was closed on a multidisciplinary training program and an exchange program for health professionals in the field of mental health. We are now evaluating the proposals. And the European Agency for Safety and Health at Work launched a new campaign on healthy workplaces last month. Ladies and gentlemen, I want to thank you for your dedication and your collaboration. Together we can strengthen the mental health of people in the European Union and build stronger healthcare systems in Europe. We saw last month such strong commitment from everybody at the Commission conference to mark World Mental Health Day. We also had a presentation by the Spanish Presidency, and I would like to thank you for your great work to advance on the mental health file. Together, we will change the realities of those patients living with a mental health problem and their families and carers. I wish your conference every success. Thank you very much.
Thank you very much, Mr. Schreck. Es fundamental lo que comentaba.
It is essential to have that work together. I really thank you for your presence here, Secretary of State Niemeyer and General Director. We will keep on seeing each other all around the day. And now I'm going to ask for the speakers from the first roundtable to come up to stage. Now we're going to see specific experiences. What we have heard so far seems clear, And it seems clear that we have to tackle this problem together. And given the very narrow relationships that we have among the different countries in the European Union, it seems that this is the correct and adequate framework to do this. We want to know what exactly we're doing, what's the room for improvement, how we can benefit from working together all around the countries from the European Union, and also what are the steps that are being taken in our country. We're also going to be talking about Asturias, we're going to be talking about Spain, and in a European level as well for the joint action implemental. It is a European strategy that we will get to know from different perspectives. We have a communitary perspective that Stefan Schreck has just talked about. We're also going to know how this is being implemented in Spain. At the end of the day, we'll also know some of the best practices that in this framework are being currently being developed. In this way, if we are more or less prepared, if the speakers are more or less prepared, I'm going to ask the General Director for Public Health, Pilar Aparicio, to come up to stage whenever she wants.
Como les comentaba antes,
Just like I said before, we have some time because we have to put the mics on the speakers. So we have to wait a little bit.
para la próxima mesa les prometo que me prepararé un discurso.
So I'll try to make a longer speech for next time because I don't want you to just stay here in silence while you wait.
Pues voy a dar la bienvenida a la directora general de
I want to welcome the General Director of Health, Pilar Aparicio. Now we only have Angel left. Angel was talking before, was speaking before. So now he'll be on stage.
Directora general, ¿cómo está? Muy bueno.
General Director, how are you? I'm very happy to be here. Well, thank you. How are we going to organize this panel? I'll just give the floor to Pilar, and then we'll do 3-minute conversations, and then we'll start our panel so that so General Director, you can start. Well, after this general vision that you've given us, now we'll start by talking about specific experiences from member states. While they're getting mic'd up, all the panelists from this panel, I'll just introduce Joanna as well, who is the Health Ministry from Finland. That's going to tell us about the mental health strategy in Finland and how they deal with promoting health.
Maybe you did that. Okay, thank you. You have it there and there.
So thank you for inviting me. I have to begin with a small correction. I'm not from the Ministry of Social and Health Affairs of Social and Health. I'm from the Finnish Institute for Health and Welfare, which is a research organization just underneath the Ministry of Social and Health. But I do work with the mental health strategy in Finland. As I said, my name is Johanna Griswold-Smith. I'm a senior specialist at the Finnish Institute for Health and Welfare. And I'm here today to speak to you a little bit about mental health promotion within the Finnish mental health strategy. So the mental health strategy was launched in 2020, so a few years back. And it was launched within the context of a big health and social services reform. And the objective of the reform, which is ongoing, is to, very much like was spoken in the introductory discussions here, was intended to improve access to high-quality mental health and health and social services care, including, of course, mental health, and developing healthcare and social welfare services by improving the structure and different connections there. Another big part which happened within the reform was moving the organization of health and social services from municipalities to larger counties. So there's a big reform, and as I said, it's still ongoing. And the mental health strategy came within that. Like I said, it was launched 2020, and it spans to 2030. So one important point that we've made, or one important thing that we've done well in Finland, is that we've tried to include a very long period of time. We understand that these changes happen very slowly, so we wanted that to be reflected also in the number of years included in the actual strategy. So our mental health strategy is formed on 5 points. It corresponds very well to the comprehensive EU approach. So these 5 points or 5 pillars bring up sort of mental health as human capital. And this is where I work mostly, which is a lot about mental health promotion and trying to promote the positive on different levels. We also have a very important point, mental health for children and young people. So developing positive mental health and mental well-being for children and young people, but also offering plenty of opportunities and equal opportunities, as well as creating supportive environments throughout the different sectors. Like was also mentioned here, we need to work with mental health in different sectors. Mental health as a right concerns mental health legislation and comes from a human rights perspective, and addresses also mental health related stigma. So trying to reduce the burden of stigma for people with lived experience of mental health disorders. The 4th point looks at broad-based mental health services, so doing a lot of work with improving services, meeting individual needs, looking at high quality service and making sure they're equal across our country. We have a very long country and there's different health discrepancies there. So trying to make more client-driven and needs-based and accessible services. And then we have the final point, which is mental health management, which is really about making sure mental health is evident in all different sectors. So working with different ministries, working with different, for example, NGO sectors, educational sectors, making sure mental health is in all areas of our daily lives. So that's our strategy in a nutshell. What I'm going to look at a little bit more in detail is looking at mental health promotion. So very much looking at how we can build mental well-being in daily life. And now, of course, we do need health services, we do need social services. This is all important blocks of this. But here we are recognizing also the role of daily life and how important the conditions of daily life is for promoting mental well-being for the whole of the population. So we are looking at different levels and promoting mental health on the individual level, perhaps via different initiatives relating to improving mental health awareness or so on. On the community level, making sure that we have support within the community, that people can get a sense of belonging within a community, that we have points in community where everyone's welcome. And also looking at social structures, looking at equality, looking at the living environment, does it correspond to mental health? How does the daily life on the outside impact us, and what improvements can we make? And all of this is, of course, surrounded by the policy level, and that's why it's really important that we have events like we do today, so we can talk about how we can improve policy so we can get to the daily life. Policy creates daily life for us, conditions of daily life for us. Another area which is very important in the Finnish strategy is Chapter 3, which looks at measurement. We know that it can be quite difficult to measure really broad-based things. So we, in Finland, have tried to improve how to measure the effects, how to evaluate policy, for example, in different ways. Evaluation is also being improved on very much on grassroots level with different kinds of, for example, within health registers with coding, so we can have more information about what is happening in different services. But another part of it looks at how we can try and really get some concrete evidence around these broader services or broader-based mental health promotion activities. So in Chapter 3, like I said, it looks at a lot of measurements, and I'd like to pick out two examples that we are working at the Finnish Institute for Mental Health, Finnish Institute for Health and Welfare. We are working specifically with two of these points, and that looks at mental health impact assessment and mental health literacy scale, mental well-being literacy scale. So looking first at the impact assessment, we started off with a systematic review and found that there are quite few impact assessments that deal specifically with mental health, and even more few that specifically look at the positive components of mental health, so looking at mental well-being. So we did a thorough review of what is available, and we also did some work within our municipalities and sent out a survey to see how people do on the grass level work with mental health impact assessment. We found that there was a lot of interest in impact assessment, and people wanted tools, people were keen to learn more, but we also learned that people were unsure with terminology. We found that there was a mix of terms used and that we need more clarity around what mental well-being means, what mental health problems means, and so on. And making very clear impact assessments and very specific around what we're actually trying to measure.
Joana, 2 minutos.
1 minute.
Dos.
2. So we created a framework for mental health impact assessments that's now being launched in Finland. The second point that I wanted to make was looking at mental well-being literacy. So when we talk about literacy, we're talking about knowledge around mental well-being. How well do we understand the concept of mental well-being? How well does the general population understand the concept of mental well-being? And this is something that we're trying to develop in a scale at the moment at THL, trying to find different ways of learning, firstly, how people understand the concept, so that we can then develop services and develop opportunities in the community that supports these things, so we can promote the mental health and mental well-being of the entire population. So a couple of takeaway messages looking at mental health promotion that we need on all levels and in all sectors of society. We need improvement in evaluation. Impact assessment is one of these opportunities, as is looking at mental health literacy. And also this final point that we need to look at broad policy spans, so we can make sure that it has enough time to sort of take hold in our communities. But thank you.
Thank you so much, Joana. Muchas gracias, Joana.
Thank you so much, Joanna. I think your presentation has helped us. And thank you, Joanna, for sharing your experience on the Finnish Institute of Mental Health. So I just wanted to correct my mistake. You're not from the Ministry of Health. You're from an institute of research. And I think that you're giving us a very interesting perspective with regards to that assessment that you've talked about of mental health and the measures that we can take that we can make to progress. Now it's my turn. I'm going to start talking about the mental health strategy in Spain. Well, we'll go to a different member state now, and we'll talk about how we're working on mental health in our country within different territories in Spain. So we think that due to the fact that primary care in our healthcare system is very important, we should give the data, which is 4.8 million healthcare registers, we see that out of those 4.8 million people, 27% of people come to primary care to talk about depression, about anxiety, and they take also pills that are related to that. So I think that due to the pandemic, we have seen an increase in all these mental health conditions. And we have seen that now there's a broad spectrum of people that come to us. So it's not only about kids or adolescents, it's also about adults that come to us. But different people come to us and talk about the stress that they go through and those problems of mental health that they go through in our society. Our national health system adapts to the different strategies that we have on the screen. And it includes the scientific societies and our autonomic communities. And we treat equally everyone that lives in any city in Spain. So we deal with the most important mental health problems and the most complex ones. So in that sense, our country started that work on mental health, and it has worked on that since 2022. They have focused on the rights, on people's rights, and they have improved their conditions. Their the goal is to put people in the center of mental health rights, and it's also important to put families in that center and also promote disease prevention and also how to get better and to be integrated in a society. It's also important to have a gender perspective in healthcare and also in other systems. We have this structure, which is how we work, and on our mental health strategy, and we include that fundamental and essential participation, which is key so that all the different cities and scientific societies and patient societies could consider this strategy as theirs and included in their daily lives. So in that sense, our strategy, our mental health strategy, has 10 strategic lines that include all the important aspects, like the autonomy and rights of people, and promoting mental health and preventing diseases, prevention and early detection of suicidal behavior, care for people that have mental health disorders, and also in different and creating a model so that people could get better in different communities. This is something that's very important in Asturias. We also have considered kids and also adolescents. And we also take care of family intervention, and we give research and innovation a key role. So this strategic plan has also an action plan that has a ministry health budget that serves as a lever to develop those strategic lines. So the first strategic line is to reinforce human resources and well-being and mental health well-being. And also, we optimize the comprehensive care. And thirdly, we also try to sensitize and fight against the stigma related to people that have mental health disorders. And we also have prevention, early detection, and care for suicidal behavior, and also how to deal with mental health disorders in contexts that are riskier. And also we prevent behaviors with substance and non-substance addictive behavior. We also have to reinforce human resources. I don't want to talk a lot about the details of these strategic plans, but we just have to go through the general lines that I showed you on the screen. We can see that each city and each community increases its participation. We also, when we talk about care for people that have mental health disorders, we also talk about resources, human resources, and this is an effort that we have to do together, the Ministry of Health and also each autonomous community, and we have to create a specialized care. So these efforts in mental health also follow the rules of the central government, which is related to fighting against these problems and this lack. And it also has this comprehensive approach that includes kids, social services, and different approaches. And when we talk about optimization, we talk about a lot of topics. That's why we wanted to implement a regional action plan, in all the autonomous communities. That's why we wanted to work on that. And we wanted to improve accessibility to improve the healthcare centers. And we also wanted to improve the infrastructures related to community health. And we also wanted to improve gender violence care, and it's something important for women that suffer and go through that. So we wanted to introduce in mental health care all those digital elements that improve our work. So we also wanted to improve our service portfolio at a national level, and in that sense, the interventions are not are complementary. It's also important to say that a lot of scientific societies have met and created this strategy to implement and add value to our society. And they have looked at the elements that we shouldn't do because they don't add value, and they took them out of the strategy. So this was a contribution of the scientific societies and the health ministry. So this is also important. We work on the stigmatization, on fighting against stigma. And in that sense, I wanted to show you that we're making progress in the progress that we've made in the involuntary restraints and the registries of those, and how we've measured that. So we'll talk later on suicidal behavior. That's why I won't stop here and get into the details, but I think that it's also important to work on mental health in riskier contexts, especially in infancy and adolescence. We've done that work with the Ministry of Education and Ministry of Health so that we could focus on the kids' well-being and also the adolescents. In that sense, it's also important to work on training for adults and also show the elderly how to participate in active aging. It's also important to talk about substance abuse, and it's also important to coordinate. So thank you very much.
Y vuelvo a mi papel.
So I'll go back to my coordinator role to present the third speaker, Angel José López Díaz, who is the General Director of Mental Health and Public Health, and he'll talk to us in detail about the strategy of 2023-2030 in Asturias.
El plan de salud
Mental health plan of Asturias 2023-2030 and our guide for education system that is called Prevention and Protection Against Suicidal Behavior. Because the content is aligned with the presentation that Pilar has just made, and I knew that, I am going to say something. The contents of this plan of Asturias and the process of elaboration and implementation are very complex. So it's very hard to explain it in detail in a few minutes. So what I'm going to do is to invite you to decide by yourself and look it up in the Ministry of Health website. And what I'm going to do right now is very different. The name of the mental health sector is a name that we could consider as very dark and confusing. Not only does it reflect this duality that is not easy in this current context and climate, but it also includes the mental health and includes other sectors in the health sector that are not in close contact with mental health. But inside this sector, it's very hard to look at the components and the links that are between those components. That's why the efforts to talk about this topic is commendable. And we have to detect the nature of this sector. What are the terms that we use? What are the links? And what are the operations that we could do? So that's why I want to define in a more precise way our sector. Because if we don't, what we could expect is to find two things. Either activism with intention and ineffective, or risking the first principle of ethics of classical tradition, which is to not hurt and not harm. That's why in our mental health sector, we wanted to define precisely. And what we've achieved is clear conscience that any incorrect definition in our sector could create an incorrect diagnosis of the current situation of the data that is related to the practice that is institutional and social. So a lot of speeches that have altered reality in our history are sociology, radical sociology, and medical reductionism. So when we refuse these reduction, we find that everything is linked to everything, and any different approach is legitimate. So when we find ourselves in this situation where there's a sector that has very difficult definitions, we find ourselves in a situation where we have to establish diagnoses that might be complicated. So the need to intervene in human hurt or harm, it's a right. It's our duty. Our reality the nature of this sector, we find that it forces us to intervene. Our only resource is to work on mental health. So this changes the intervention paradigm, because now it's not only technological, it's also on a conscience level. So that's why when we talk about science philosophy, from this perspective of science philosophy, we started this strategic plan, because not even biomedical technique and management or company management, which are good models, can be enough to intervene. We have to intervene from a triple perspective: ethical perspective, which is very concrete and specific, with the conscious of different interests from different groups, and in a framework, in a political framework. But it's also important to summarize this approach, which takes us to not being able to identify a sector without this philosophical and scientific approach. Our sector is not a technological sector. It's not a scientific sector. It's a social institution where we have relationships between people. That's what we have. That's why when we intervene and when we approach, we have to guide ourselves by those components, those social components. So that's why we have identified the values of our plan that are related to freedom, to fighting against discrimination, to solidarity, and also to our Asturias route. We have chosen the action models with the approach of the different healthcare and mental health protection approaches. We have established 3 intervention orders that are aligned. I have 2 minutes left. Okay, I'll be quick. Aligned with the references, the international references. And what we find here is that the UN, the EU, the Spanish government, the Asturias government, they always declare this community approach. But then in practice, we see that it's more institutional than communitary. So we have identified 3 interventions. The first one is equality in mental health, to improve our environment and to guarantee a good health space. So these are the components that we have created and that we want to implement from 2023 to 2030. So if you want to know in detail all those 246 actions that we want to implement to promote well-being and to prevent suicide, I'll invite you to go into the website of Astur Salud, which is our government's website that integrates all the mental health and health plans, and to explore that website and see all our plans. Thank you so much.
Yo creo que la verdad que agradezco.
I think that we should thank, and we're very thankful for Angel, for that philosophy, for that speech that has helped us see the basic aspects, like to define mental health and define this event. And it's something that's present in this event. So thank you for sharing. These tables are a little far from the public and the audience. And I know that Angel doesn't like to be so close to the public, to the audience. So maybe we'll get closer later on. I know he likes to see to you further. So he also likes to be here to share. And that's why we're here. We're here to share the different experiences in the framework of the European Union on how to approach these strategies and these joint actions. For example, the implemental joint action that looks for the best experiences in different countries of the EU, so that we can share them and we can develop them in other actions. So today we have the Joint Action Implemental Coordinator, Vasilia Conte. So you're welcome to the stage so that you can share your knowledge.
Okay. How I do it?
This is just for the slides.
The slides?
I don't know, you have your presentation?
They all change them?
Okay, is there, no?
Okay. Thank you. The middle one.
Okay, yeah.
We always learn new tricks. So thank you. Dear ladies and gentlemen, it is a great pleasure and honor to be invited to present JA Implemental and talk about synergies at member state levels in implementing best practices in mental health. It is well known that mental health problems affect more than 1 in 6 persons in Europe, and suicide is the second leading cause of death among the young. 9 out of 10 respondents in the recent Eurobarometer survey consider that mental health promotion should take and be as important as the physical health activity promotion. This highlights the importance of mental health as an integral part of health and the need to focus on early diagnosis and prevention of mental health issues, as well as the provision of care and services for those in need. Joint Action Implemental of best practices in the area of mental health is a major program initiated on the request of Member States on October 2021 with a duration of 3 years. So we are now in the 3rd year of implementation and is co-funded by the European Union Third Health Programme by 80%. It aims and it covers what we have discussed today. It aims to support member states to improve and promote mental health via innovative and sustainable change. It reinforces the capacity to address a system transformation by citizen-centered and integrated approaches, increase system efficiency and build and maintain synergies, emphasizing the users' and families' participation. Of course, it specifically aims to support the transfer and pilot implementation of 2 best practices, the Belgian best practice on community mental health system reform and the Austrian best practice on suicide prevention. This is system reform from the Austrian best practice on suicide prevention and mental health system reform should not and cannot be adapted and transferred to a country without taking into consideration the national governmental actors and the actual needs, finances and human resources. So it needs to be adapted when it is transformed. And we will see this when it is presented by our Spanish team. A strong involvement of national and governmental actors is evident and it is implemented as well. We have a Member State Policy Committee that helps and ensures that we are going the right way in alignment with national strategies. And finally, the last objective is to sustain cooperation and involvement of a wide variety of stakeholders across not only the national level, but also the European level. We are currently implementing 25 pilots across Europe. More specifically, using the Belgian best practice, 14 countries are piloting and implementing changes in their community mental health systems. You see the wide variety of actors across Europe, and of course Spain, one of the key implementers in this joint action with a big team in Murcia region, and in a wider level it is also key lessons learned that is closely watched by the Ministry of Spain and seeing how it can replicate and gains in other regions. By using the Austrian best practice, 17 new or adapted suicide prevention plans across Europe will be formulated. And you see the countries that are participating in blue in this joint action. What is important to see is that in 11 countries implementing the Belgian best practice, pilot action plans have been developed in 5 key strategic areas. And it's important to understand that when we act, we have to identify the synergies between the Belgian best practice, what we want to implement, and how it can be translated in other countries. So the development of regional and local networks with a network coordinator based on intersectoral, multidisciplinary and recovery approach, with active involvement of all key stakeholders, the strengthening of mental health service delivery, human rights-based and user-centered, the application of trainings, the introduction of information and awareness activities, and of course the strengthening of data collection through a standardized set of indicators, a dashboard that will be necessary to be implemented across Europe, but not only that, but also the monitoring and evaluation of our pilots, because the enablers, facilitators needs to be really documented so that they can present information that can be used for future activities. In total, 167 activities and measures under this best practice are currently implemented across Europe. In the 14 countries implement the suicide best practice, SUPRA, the pilot action plans are around 6 strategic areas that involves namely the coordination. That is important for that big actions on suicide on national and regional level, the support for treatment and for risk groups, the specific actions for restrictions of actions to medicines for suicide, the increase of awareness and knowledge, the integration, again, the integration in broader sectors of the suicide prevention, and the improvement of expertise in data registry. So you will see the synergies between the 2 best practices, the broad areas identifies, but also the bigger effort on the mental health system reform and the more concentrated effort that we are doing on suicide prevention. In total, 142 measures under this best practice are currently implemented across Europe, so it is a huge effort. In this effort, 39 organizations from 21 countries, more than 200 people are working together. This is the strength of GA Implementer, this core critical mass of dedicated and motivated personnel that works together in the network, sharing knowledge and experience. Actually, sharing knowledge and experience is what we are actually doing. And it is also necessary to understand that we cannot work alone in this. We are working together with the key stakeholders that bring in their views and interests and expectations and disseminating our activities, and the Member State Policy Committee, that it is our level of policy that help us to be sure that these efforts are embedded in future activities. This is our stakeholder forum. And this is something that I also wish to speak about, the implementation process that we use. It has 3 phases. The implementation strategy, it is well known that from implementation science, that in order to implement something, it is not only the what, it is the how we will achieve it. So we need tools that help us to achieve it in a way that is coordinated and interlinked. So what are the major challenges from our best practice that were identified by our consortium? The resistance to change, the engagement of stakeholders, the sustainability of funding and resources, availability of reliable data, and shortage of mental health issues, well described also before in the presentations. What are the major lessons learned? Customization to local needs is crucial to success of implementation. Interprofessional and intersectoral collaboration is key to successful implementation. A realistic action must be designed based on activities that are focused, feasible, and practical. And what is the feedback based in positive outcomes that we managed to do? Improve collaboration with stakeholders, manage to use tools that can be transferred in other areas, that the community-based service development and improvements can be seen through this joint action, and that it is also important to implement quick wins. Sharing experience and knowledge, stronger international networks and opportunity of change. That is the feedback that we gain. And coming to the stakeholders' messages, I wish to point out two messages that are really important, that they advise us that these actions take time, so we should not be impatient. We need more time for implementation in order to create a change. That is an important message. It is important to keep involving the people with lived experience, the families, the professional decision makers, because this good best practice that we have can bring them in their perspectives and make it in a co-creation process even more effective. It is important to fight stigma and embrace the human rights approach. Of course, necessary to document barriers, challenges, and facilitators in order to learn. And sustainability includes not only securing finances, but also securing leadership and capacity building. And from our Member State Policy Committee, which I think it is important that I'm closing, it is that GA Implemental is aligned with our the national strategies, but it needs to be adapted and amended, and that the results of country pilots can serve as a landmark for further contribution of work at national level. With this, I would like to show that these activities that we are doing are scaling up with projects, results, the national strategies, the new EU communication on comprehensive approach. We talked about the intersectoral and the promotion of suicide prevention, fight of depression, and of course, the synergies with our stakeholders. It is important for us to follow up. If you want to learn more about GE Implementer, you can follow us, and we strongly advise you to, in our website, social media events. And you will find more, as the previous speaker said, about what we are accomplishing and how it can be useful for you as well. Thank you very much.
Thank you very much, Basilea. I think with that experience, we get, member states of the European Union, we get more close. We learn from one country to another country, and it's the way that this joint action give us the reality of the Europe. Thank you so much. Now, vamos a pasar ahora a la experiencia.
Now we're going to move over to the experience of the same joint action, but in Spain, with Maria Jose Lozano. She's General Director for Mental Health in the Ministry of Social Policy, Family and Equality in the region of Murcia. Sorry, I mean mental health now. The region of Murcia is also coordinating in Spain, as Basilea was also saying before, this joint action for this implemental action. Good morning. Thank you very much to the Ministry of Health from the government of Spain for having allowed us, the region of Murcia, to represent Spain in Europe, together with 5 other regional governments that are participating in the joint action implemental plan. I'd like to thank Basilea and want to congratulate you for the great job that you're doing for the coordination of this project, which is the implemental project. I'd like to try to explain a humble project that we have been doing in relation to the replica to the Belgian action we are developing in the region of Murcia. The region of Murcia is one of the 17 regional governments that are part of the Spanish government. We have a surface of around 11,000 300 square kilometers. We have 45 municipalities. We're approximately 1.5 million inhabitants, and around half is women and around half is men. Services are organized in 9 healthcare areas, and we have differentiated different primary care and hospital care services. Management of social services is also differentiated in services of primary care, which are in charge of municipalities, and specialized action, which is part of the responsibility of the service of social actions in Murcia. We have several mental health centers in which we help adults, children, people with addictions, and teenagers. And we have 5 psychiatric hospitalization units. We also have 1 regional unit for hospitalization for children and adolescents for regional stay, long-term stay. We have 5 units for rehab, mid-stay hospitalizations with serious mental health disorders, and 4 daycare services. 1 is for adults and 3 are for children and teenagers. We also have other services, which are therapeutic communities, daycare centers, and mid-stay centers. It's interesting to have to come to Asturias precisely to talk about the start of the project of the psychiatric reform, when this regional government has been the one that started this kind of projects. It's the regional government that has the most experiences and the most lessons to teach the rest of the regional governments. And in the field of social services, as I said, the responsibilities are inside the Murcia Institute of Social Actions, which are coordinating all the dependency actions, all the daycare centers, and lately the promotion service for autonomy. I'm going to be talking about the previous cases a little bit to try to locate ourselves on how we wanted to develop this project. We had 1 old psychiatric hospital that had approximately 800 or 900 people when we started psychiatric reform. And in the region of Murcia, what we did was to divide the field of healthcare, and psychiatric hospital has some beds for the hospitalization for serious cases and what we called back then subacute disorders. And the rest of the patients who were having long-term stays that could not be taken back to their communities, they would start depending on the IMS, the institute I just explained. We did that in order to try to work with families. We created the first family association, and we give back an important number of patients to their community environments. As I said, all those that could not be integrated in their communities, they moved on to be taken care by the social workers. We also had a municipality service for the psychiatric sector that had spots for 60 people. And when this new law for the promotion of personal autonomy and the assessment of independency, we offer as single resources all those patients that had been assessed. We gave them the possibility of either being in a nursing home or in a daycare center. This makes the fact that in that environment, social entities and companies, they understood that there was a possibility of generating, because we had a high demand of this kind of services, and we created a series of nursing homes. All of them had practically replica character of what we had in psychiatric hospital. They are closed nursing homes with a very high number of spots and with the character of an institution. So why did we think about this, and what do we want to do now? Being knowledgeable of this division between the healthcare sector and the sector of social services, we started to think some years ago, well, many years ago, that this disconnection did not make it easier at all for the attention that people with serious mental disorders needed. That's why in 2016, we started a protocol for the social and healthcare coordination for the care of those people with serious mental disorder in a regional commission for social and health services. This protocol was described 7 years ago, and what it wants is to achieve new goals. The first one is to align this ensemble of systems for protection of social and healthcare protection, to try to build a conceptual scheme in order to organize coordinated interventions for those people with serious mental disorders. The second was to give local answers to local needs for those people with severe or serious mental disorders. They had to have the participation and decision of users, and it had to be under the model of recovery. And lastly, we wanted to reduce the risk of institutionalization through a coordinated and comprehensive intervention, which is simultaneous or successive of the different protection services for healthcare and social services, both public and private. That is the protocol. That protocol is organized in base of the last two elements. One of them is the Commission of Coordination of Area, which is coordinated by the manager of the correspondent group of whatever area that is delegated by, that is made by people in the field of social services, together with the entities of the third sector that are operating in that area. I'll move on to the development of the project of the joint action. With this situation and with the previous cases that we had with the development of the protocol of social and healthcare coordination, we received the proposal of the Ministry of coordinating this action. Our adaptation is based on the replica of the reform that was done in Belgium, and it's based on the following aspects. We have called it Inclusive Life Projects. Why did we call it Inclusive Life Projects? Because we believed it was the goal that we wanted to achieve. And the goal was that the people that had been diagnosed with these disorders, so that they had the possibility of staying in their environments with all available resources, so that we could reduce or avoid the risk of institutionalization. Our project is mainly based on the idea of trying to avoid or reduce institutionalization. And secondly, we would try to want to have the possibility of deinstitutionalizing people who are already institutionalized. We want to offer a comprehensive care. We want it to be integrating, and we want it to integrate people. And we want to think about the several steps of the project. And for this project, we selected 5 municipalities, following criteria that had to do with population, with how far away they were from the capital, with the relationship they have with the third sector, with local councils, etc. The municipalities that were selected were Yecla, Molina de Segura, Caravaca, Lorca, and Cartagena. This project wants to give a service to 50 or 60 people with a ratio of 1 professional for each 10 or 12 cases. The key elements for the Belgian project that we wanted to include, and we have included, is first of all creating networks. We already had that protocol of social and healthcare coordination. Secondly, starting mobile teams, because we had basic teams in the the social and healthcare coordination protocol. These first two steps. Then the third one is the individualized attention or care plan. In the mental health network, we also had coordinated plans. We also had the active participation of the person. We wanted the user to be included in the decision-making process. And this is the new action that adds more value, and it's a replica of the Belgian project, which is the professional as a reference of the care. What we've done is to give funding to local councils. This project has a series of stages, and I'm going to be talking only about what we did in order to start it, which is the moment of the implementation. So there was an analysis of the different needs, then we had agreements and dissemination. What we did was to visit all local councils in order to try to disseminate the project that we were presenting in the regional commission as well, to identify the municipalities. Fourth, to negotiate with the local councils about the funding and the action plan. Fifth stage was the signature of the agreements, and then we agreed on the funding that was going to be done in the region of Murcia. They are going to invest €1 million over these years for the development of this project. Then we met with the basic teams that are integrated by the people in charge of the social and healthcare services. And in the last stage, we designed the action plan in itself. We are currently in the implementation stage. And I'm going to finish up with this. From the implementation stage in which we are right now, I would like to mainly highlight that, first of all, we created the working groups. One working group that was regional, which is the one that is going to oversee the whole project, and then local groups in each one of the local councils. In a second stage, we created that dissemination. We have created workshops and training programs for the people in those teams. We have also identified the resources we still have hired through the entities of the third sector that are funded by local councils that are going to be following the agreements that we have signed. We have hired the people that are references of care. We have adapted the tools that we're going to be using in each one of the environments, and we are in the stage in which we have already identified the patients in which we're going to intervene. Well, these are the photographs of the local councils in which we were in order to sign the agreements. And I wanted to end up with this slide that picks up a little bit what the project is. The project is focused on the individualized care plan in which the patient is in the center, and their reference, who is someone from their environment, family, friends, they choose it. They choose them, and we have a reference of care that is hired by the third sector entities, and they have action funding plan in order to cover all the needs that the person may have in the moment in the whole process of their recovery. Lastly, I wanted to highlight that we have achieved something that we believe is a revolution, at least in the region of Murcia, which is to put together all the IT systems from the healthcare section and the social services section through a program that's called Petra. Someone from IT has achieved a project in which, for a specific case, all the professionals that are intervening for that patient, they have access in real time for the sharing of that information, of that accompanying process of the professionals for that patient. I'm going to leave it here. Thank you very much.
Gracias, Marifé. Muchísimas gracias, Marifé. No solamente
Thank you very much, Marifé, not only for your enthusiasm and for starting a project which seems, at least, together with the experience of Basilea, they all seem like great initiatives. And from this joint action, we want to have the best practices, at least in this case from Belgium, that has done this communitary reform, or from Austria with that suicide prevention actions. It's true that from the experience of Murcia and Asturias in our country and in our environment, we have also seen those reforms that have been necessary and The truth is that I wanted to highlight from that last presentation that effort and the coordination that's so necessary, and we all talk about it, especially when we were talking about patients that have serious mental health disorders, and the importance of the coordination of social services and healthcare services, and that attempt of not only not institutionalizing people, but also institutionalizing those that are already institutionalized, and also the importance of local support. With the support from several member states, from several regions, and with that interest that Joanna was talking about, of that search and that evaluation and assessment of the impact of that collaboration, I believe with time, because Pablo is looking at me because we're running out of time, we're going to end up with this necessary debate, because since we have half an hour of a coffee break, you'll be able to interact directly with them both in the coffee break and also in the lunch break. So I'm going to leave you to ask the questions in the break, just to try to catch up with time. And Pablo, I'm going to give you the floor again. Thank you very much. Thank you very much, Pilar. Thank you to all the speakers. Something that for me was quite scary, and it's when someone says, I'm going to try to keep it short. It's something that we don't always comply with, and it's very hard to make a summary of all our efforts. I really want to thank you all for all your efforts, for having showed us everything that you have done so far. As the General Director said,
30 minutes, and see you now. I'm going to ask, please, the next speaker to stay here in 25 minutes. Thank you very much. See you now.